In the paranasal sinuses, maxillary sinus is the largest and most commonly infected problematic paranasal sinus. So that is the maxillary. So maxillary sinus, as the name suggests, it lies in the maxilla bone. So maxilla bone is a pneumatic bone. So it is hollow from inside. So air is trapped during the development of this bone. So if we see the maxillary bone in the front, the norma frontalis, so it lies just below the orbit. Laterally, there is the bone of the cheek, that is the zygomatic bone, and this is the anteriorly. This is the anterior surface of what is called the maxilla bone. So this is the anterior surface of maxilla bone. It articulates with the nasal bone, and superiorly with the frontal bone, laterally with the zygomatic bone. And this is the infraorbital foramen in the upper part of the maxilla bone. And this is the anterior wall of the maxilla. So just here lies the maxillary air sinus, which is the shape of this sinus is wedge shape. It is the wedge shape sinus. The base of the sinus is medially present, just adjoining the lateral wall of the nasal cavity, and the apex is directed towards the zygomatic bone. So that is the roof and this is the floor. So the distance laterally it is 3.5 centimeter, superiorly also it is 2.5 centimeter, and anterior-posterior is also 3.5 centimeter. So there is the dimension of this wedge-shaped maxillary air sinus, which lies just in the maxilla bone. So regarding its boundaries, it has got a roof. It has got a medial wall, it has got a lateral wall, it has got a floor, and it has got the anterior wall and the posterior wall as well. So this is the what is the called the maxillary sinus. So as this is the anterior surface of the maxillary bone, this is the lateral surface where the zygomatic bone is there, and this is the posterior surface of the maxilla bone, or also called the infratemporal surface of the maxilla bone, because it lies below the zygomatic arc. So posterior part is also the maxilla is there, and this is the largest part, that is the maxillary air sinus. So the sinus make the skull lighter also, plus they are also responsible for the resonance, and their openings are in the lateral wall of the nasal cavity. So because of their opening in the nasal wall of the cavity, so plus they are also lined by the ciliated columnar epithelium. So it signifies that these paranasal sinuses, they are the extension of the nasal cavity during their development. So they are also lined by the same ciliated columnar epithelium with goblet, and the mucus producing cells are also incorporated with the ciliated columnar epithelium. So regarding the roof, so this is the roof of the maxillary sinus. So in this we have made the sagittal section of the skull, nasal septum is removed, and a part of the lateral wall of the nasal cavity is also removed, including the inferior concha and the middle concha, and the superior concha is removed in order to show the medial wall of the maxilla. So if we see from the medial wall of the maxilla is removed, the medial wall is formed by the lateral wall of the nasal cavity. So this is the medial wall. So this medial wall of the maxillary sinus is formed by the lateral wall of the nasal cavity, which is formed by the inferior concha, which is itself is a bone, and the middle concha in the upper part forming the medial wall of the nasal maxillary sinus. The roof, if we see, roof is formed by the floor of the bony orbit. As we know, bony orbit lies just above the maxillary bone, and here lies the optic canal, is superior orbital fissure, inferior orbital fissure. So this is the lateral wall, this is the roof of the bony orbit, this is the medial wall, and this is the floor. So floor is formed by the maxilla bone. So this is the maxilla bone, which is forming the roof of the maxilla. So if we see this, if I am touching the roof of the, so this is the maxillary sinus is opened here after removing its medial wall or the lateral wall of the nasal cavity. So here is the roof. So if we see the roof, it is formed by the floor of the orbit, which is also formed by the bone, that is the maxillary bone. So this is the roof. And see the shape of the maxillary sinus. So apex is directed laterally towards the zygomatic bone, and this base is medially directed from and abutting the lateral wall of the nasal cavity. So this wide opening is actually the medial wall of the maxillary sinus, which is removed to show the interior of the maxillary sinus. With the roof, below is the floor, this is the anterior wall, the posterior wall, and facing is the lateral wall is also visible. So roof and lateral wall is made by the floor of the orbit. So roof is formed by the floor of the orbit, which is bony, and medial wall is formed by the lateral wall of the nasal cavity, and this is the lateral wall. If we see the lateral wall also here, so here also we have removed the posterior wall of the maxillary sinus to show you the interior of the maxillary sinus. So the posterior wall removal, and this is the interior of the maxillary sinus seen from the posterior aspect. So this is the posterior wall is removed. So lateral wall of the nasal cavity of the maxillary sinus is formed by the maxillary bone, which is articulating with the zygomatic bone. Now regarding the floor, So floor is formed by the, if we see the floor of it, so this is the lower part is the floor, and this lower part of the floor is formed itself by the maxilla bone. And if you see the anteriorly, if you go anteriorly, so anteriorly again the maxilla bone forming the anterior wall of it, and the posterior wall, if you go posteriorly, so the posterior wall, if you see, is again formed by the infratemporal surface of the maxilla. So maxillary air sinus lies in the maxilla bone, which is a pneumatic bone. So this is how we see the boundaries of the maxillary air sinus. Now come its opening. So it internally lined by the mucous membrane, it is ciliated along with the goblet, and the mucus producing cells, they are also present in it. Now its opening is very large, and it opens in the lateral wall of the nasal cavity, and it opens into the middle meatus. And in the middle meatus there is a hiatus semilunaris. Hiatus semilunaris. And in this hiatus semilunaris there are the openings of the frontal air sinus plus anterior ethmoidal air sinus and middle ethmoidal air sinus. So all openings, they are present in the hiatus semilunaris, and it is covered by the uncinate process. Uncinate process of the inferior concha, which itself is a bone. And it opens into the lateral wall of the nasal cavity. If we form the lateral wall of the nasal cavity, so there are three terminates of the concha, elevations of the lateral wall, superior, middle and inferior concha. Actually these terminates or the concha, they are the speed breakers. So when the air enters into the nostrils, so it takes some time and it circulates, because air is lighter, so it will go upward, and it circulates into the nasal cavity for a few seconds. During this, there is a humidification of the air, plus it slows down the air current which is going into the respiratory tract, and because of the mucous cells here, the stickiness is there, and this stickiness will entangle the pollen grains, carbonous particle, dust particle, and spores of the bacteria, and making the purification of the air. So that is the purpose of these three elevations. Plus they also increase the surface area of the mucous membrane, and that the disinfection process will becomes rapid. So this is the here like the hiatus semilunaris in the middle meatus, and here opens the frontal air sinus, which directly come here and opens with the gravity. Then there is a ethmoid bone, so anterior ethmoidal air sinus, it also opens here, and the middle ethmoidal sinus, it also opens in the upper part of the hiatus semilunaris. With there is a elevation is there. It's called the ethmoidal bulla. So ethmoidal bulla bears the opening of the middle ethmoidal sinus. This is the anterior ethmoidal sinus, this is the frontal air sinus. And maxillary sinus is very large in opening, but its negative point is there, that its drainage is not proper, because the opening of the maxillary sinus is not near the floor, but it is near the roof, and that is the negative point. So all these accretions, they are collected here, and the opening is anti-gravity. All other Air sinuses, if we see anterior, middle, and then here is the posterior ethmoidal sinus, it opens into the superior meatus. So it is all follow the gravity, and their drainage is very much proper. And this is the sphenoidal air sinus, and the sphenoidal air sinus also opens into the uppermost part of the area above the superior meatus, superior concha, and this area is called the sphenoethmoidal recess. So the sphenoidal air sinus also opens into the superior meatus. Sometimes there is a supreme or the highest meatus also present, which is nothing but this is the ethmoidal bone, which gives the assessment and opening of the sphenoidal air sinus, that is called the extreme or the highest meatus above the superior concha. So this is the maxillary air sinus. So it is covered by the uncinate process of the maxilla of the inferior concha to minimize it. So hiatus seminoid has got two parts, anterior part and posterior part. So anterior part is usually covered by the mucous membrane, while the posterior part is open. So superior is the ethmoidal bulla, and this is the uncinate process. So they cover the hiatus seminoides, and anteriorly the mucous membrane covers it, but posteriorly it is open, the part. So that is how we do the openings of the concha and meatus in the lateral wall, the maxillary air sinus. So after that comes the abryodonotomy of the maxillary air sinus. If we see the abryodonotomy, that is called the maxillary sinusitis. So maxillary sinusitis is the most frequently affected sinus. The reason is that the opening is very large and it is very near to the anterior nares. So all the carbonous particle, foreign bodies and spores of bacteria, they have got a very easy and the greater access to go inside the maxillary sinus. Secondly, it is anti-gravity. Because of the anti-gravity, the secretion of the mucus already present here is all the time collected in this maxillary sinus, and this enhances the growth of the bacteria in the secretions also. So whenever a person suffers from the maxillary sinusitis, unilateral or bilateral, so patient can come with the maxillary sinus may be right or unilateral maybe or bilateral be the infection is there. So in this, the cheek of the person becomes pink or red color. It signifies when there is a unilateral redness is there, it means here is the maxillary sinusitis is there. The redness of the cheek signifies the infection of the maxilla, because maxilla bone is like just in front of the behind the cheek. Another problem is that patient is having the high running fever and the maxilla bone is painful when we touch it. So that is the sign symptoms of the maxillary sinusitis. So in the treatment part of the maxillary sinusitis, first we give the medical treatment, in which we give the antibiotics to dry up the infection secretion in it. Decongestant we also add. Plus we also do the postural drainage. In the postural drainage, we change the posture of the patient. And what is postural drainage? For example, if the right side of the maxillary sinus is affected, then we ask the patient, we tell the patient that he or she should sleep at night with the affected side of the face or the maxillary sinus in upward. So when it is in the upward position, then all the secretions in the maxillary sinus which are there, now this opening becomes the positively geotropic, and with the gravity it becomes, and because of the gravity, whole of the secretion of the maxillary sinus will come into the nasal cavity. From nasal cavity it goes to nasopharynx, and from the nasopharynx it goes to the esophagus, to the stomach, and HCl of the stomach will kill the bacteria present in this nasal, in the discharge of this maxillary sinus. So antibiotic with the postural drainage for 1 week usually dry up the secretion in the maxillary sinusitis, and whole of the maxillary sinus is evacuated and becomes empty, and patient got the relief with this procedure. But if a patient suffer from a chronic type of the maxillary sinusitis, in which pus is so formed and pus is so sticky that it sticks to the walls of the maxillary sinus, then antibiotics and the postural drainage won't affect it. And to confirm the diagnosis, we take the X-ray, special X-ray of the norma frontalis, which is called the Waters view. In Waters view, we tilt the position so that the chin should touch the suprasternal notch. So, and we take the X-ray from the front side. So this will signifies, and the maxillary sinus becomes black color, and they are not overlapped by the other paranasal sinuses and the bones. So this is the clear-cut picture we take the posture during the Waters view X-ray taken of the face. So if there is a whiteness in the maxillary sinus area is there, it means patient suffers from maxillary sinusitis, because in the normal air is present and air is black and radio opaque. So that is the Waters view in the X-ray of the special X-ray taken during the patient suffering from maxillary sinusitis. So in the chronic maxillary sinusitis, the pus is sticky and is not coming with the postural drainage is not coming. Then we have to opt a surgical procedure to treat the maxillary sinusitis. Then we have to open this maxillary sinus anteriorly, and we drain whole of the pus out of it. The operation is called Caldwell operation. Caldwell surgical operation. In Caldwell, what we do, that we approach anteriorly and we cut is made at the labiogingival sulcus. So we make the hole with the special instrument which is called the trocar and cannula. Trocar with the cannula, and we make a very small little cut at the labiogingival sulcus. So these are the gingiva covering our gums of the tooth, and this is the mucous membrane of the upper lip. So just below the anterior wall of the maxilla, we make a small 1 or 2 mm cut in the labiogingival sulcus. So this line is called the labiogingival sulcus. So we make a small cut in the labiogingival sulcus where the mucous membrane of the lip is continuous with the gums mucous membrane. So we make a slight horizontal cut and we put the trocar and cannula. So we put because anterior wall is very thin, so just by gentle pressure we can push the trocar and cannula inside and the trocar is withdrawn, and through this the pus will start coming out, and we inject the disinfectant material and we clean the whole of the maxillary sinus again and again. And this is the procedure in which we have perforated the anterior wall of the maxillary sinus to remove the thick pus sticking to the walls inside the maxillary sinus. So this procedure is called the Caldwell operation. So that's all about the maxillary sinusitis.